Good evening, class. We've been a while away, and I know some of you miss the previous classes, even though I have repeated that class twice. So I don't think we need to, or we have time to keep away for that again. So we have to continue where we stop. We stop at the terminologies used in community health. And we are on incidence rates. We have gone beyond this page before, but for today, we are coming back to this page to repeat only this page and forge ahead. So we are starting from incidence rate. The term incidence rates refers to the rate at which a new event occurs over a specified period of time. It simply describes the frequency at which new incidents occurs. This means the incidence of occurrence of a disease condition in a particular location. So this measures a commonly used in epidemiology as a way to denote the occurrence of disease, illness, or accident. This rate only uses new cases rather than previously diagnosed or reported ones. The incidence rate helps experts anticipate future incidents and make plans accordingly. So in a nutshell, what this is telling us is that the incidence rate is a measure of identifying new cases in count, and this does not include the cases that were already diagnosed before time, before the moment. So incidence rate is a ratio of new cases. So, and it is beneficial for experts to use that to determine the future incidents, and it to allow them to make plan so that they will suppress what is anticipated in the future. So key takeaways. The incidence rate measures how often a new event is likely to occur over a particular period of time. This rate provides the capacity to anticipate future incidents and plan accordingly, just as we discussed it. When you have it occurring in a sequence, 10 per day and so on. When you look at the causes, you look at the factors, you will now think of how to adjust the factors so that you will suppress the reoccurrences. So we should take note of that. Incidence is different from prevalence, which measures the total accumulation of cases. When we mention incidence, is just the occurrence, then prevalence is what has happened in general. The pharmaceutical and the biotech companies rely on incidence rates when they uses approval from the FDA, NAFDAC to get their drugs to market. They uses this to seek for approval based on what they want to curtail on ground. Is when you have issues. For example, now, when you have the need to clean up environment, then you can apply and seek for approval to produce brooms so that you can use them in sweeping. That is how this appears in the pharmaceutical industries. under their regulatory bodies like NAFDAC and the FDA. We know the meaning of FDA, Food and Drug Administration. Then we have prevalence. Even though in Nigeria here we don't use Food and Drug Administration, we rather use NAFDAC. That is why I quoted there in bracket. So NAFDAC is also an acronym for a related food and drug in Nigeria. Then prevalence. Prevalence is the proportion of a population that has a disease or risk factor at a specific time. It can be calculated by dividing the number of people with the disease by the total population at risk. Prevalence is often expressed as a percentage, but it can also be written as a fraction or the number of cases per 10,000 or 100,000 people. So what we are saying here is that prevalence is the proportion of a population. For example, a segment of a total population that has a disease or at risk or a risk factor at a specific time. For example, let me put it in this way. If we say senior citizens or under 5, let's say they are 5% of the population. And what is the population? Maybe 100,000 is the population of the entire community. So now we want to say prevalence is the population of a population that has a disease or risk factor. So if this condition is catching children, let's say measles, measles is going for children less than that, within that age range. Once you are, it's in short, it's a pediatric condition. So you can now do this calculation by applying this formula under the population of the risk factor, which is under 5, and they have a specific number. So, and over a period of time. So let me come again with the statement. Prevalence is the proportion of a population that has a disease or risk factor at a specific time. It can be calculated by dividing the number of people with the disease by the total population at risk. For example, as I said, under 5, and this condition is for children, and this is under 5. Now, if you have 50 people that have this disease, then you do 50 divided by 5,000. That will give us like 10. That 10 is the ratio of the population that have this disease condition. So prevalence is a key measure in disease ecology. Disease ecology studies. It is often used in questionnaire studies. So what this is telling us now is that if you are carrying out any research concerning diseases, this is often used to apply statements that goes with the disease. There are different types of prevalence, which includes point prevalence, period prevalence, and the lifetime prevalence, all whereas the names implies. Point prevalence, the number of cases of a health event at a specific time. Then period prevalence, the number of cases of a health event over a period of time, often 12 months, 6 months or more. The lifetime prevalence, the number of cases of a health event over a person's life, person's lifetime. This is throughout lifetime. How many times do you get a stroke attack? How many times do you get epileptic attack over a lifetime? Then prevalence is influenced by the incidence of disease and the factors that affect individual after diagnosis. A higher prevalence could indicate that new cases are increasing or that people are surviving longer without a cure. A lower prevalence could indicate that more people are dying. So all those changes refers to something. And all those timing you are checking and event you are seeing there, the datas you are getting. And for the purpose you want to see a change, is that is the purposeful. And the ongoing is timely, timely, timely. Accusation is you are getting records to keep for each time you make that observation. And it's all for clinical decision. If it's growing, probably is this and that, malignant or non-malignant. And also decisions. Should we incise and remove, or we should incise and just take biopsy, or what and what to be done? All are the aim of clinical decision making, and it's essential for improving patient safety. This is the end of Unit 1 of Community Nursing. So we will step into Unit 2. On the Unit 2, we have prevention and the control of communicable diseases. Communicable diseases control refers to the prevention or containment of diseases that can be spread from one person to another, which this involves measures such as vaccination, clean water, and the knowledge of preventive interventions to reduce the risk of infection and the benefit both individuals and the communities. We says this Unit 2 is all about prevention and the control of communicable diseases. Now, you want to prevent, you want to control communicable diseases. Of course, is you either prevent it or you contain the ones that wants to exist. When we say content, you control. You are able to cage them. You contain them. You are able to arrest them. So they are not independent. They cannot flee the way they want. They cannot do what they want to do. They are under your control. Of diseases that can be spread. Specifically, those diseases that can be spread. And though some of these actions involve quarantine when it is in terms of general public, and isolation when it is in terms of individual. You understand? For example, now in a family, if one person is affected with a communicable disease, they isolate the person so that it will not infect others. And also, you can prevent them by giving vaccination. To prevent, you give vaccination. When contacted already, you give them. Clean water, yes. Most of this disease flew and transmit through the injection of clean water. Through water. So if you clean your water, you are curtailing them. You are containing them. You have reduced them. You have killed them. You have taken control of them. You have separated them and managed them. And that is simply what it means. And the knowledge of prevention. When you give people knowledge of how to avoid them, they could avoid them and they are prevented. For example, without the information of washing hands, many people will get infected. But with the information and knowledge of wash hands before coming in contact with any food or water that you consume, then it's reducing. And that is knowledge. That is knowledge of preventive interventions to reduce the risk of infection. And also, when you get contacted, what to do? For example, when you touch an infected person with skin diseases, wash your hands with antiseptics, use sanitizers, and so all those are from knowledge, and they are interventions, they are preventive interventions to reduce the risk of infection and the benefits. And this also benefits the individuals and the entire communities. The prevention and the control of communicable diseases involves measures to stop or to reduce the spread of diseases from one person to another. Those measures can include vaccination, as we mentioned, then hand washing, and also the use of sanitizer. Also, sanitations. When you clean your environment, the specific vectors will not grow, will not be in the prevalence. Also, safe food handling. Safe food handling. When we say safe food handling, it entails all good practices to produce food, cooking measures, sanitary of the cooking environment, sanitary of the cooking process. That is, wash dishes, wash hands, wash surfaces, and clean everything. Clean dishes and wash dishes, all are the safe food handling. Like close cover food and whatever and whatever. That's safe food handling. There's safe sex practices. We all know what safe sex practices. Stick to one sex partner. Use condom and so on and so on. These are just safe sex practices. They're avoiding contact with wild animals. So wild animals have their normal flora bacteria, which could be a disease to us. Yes. For example, the dogs, cats, all those white cats, specifically dogs. The saliva of a dog has been tested. It contains a lot of bacteria. And when you didn't stay away from them, they could lick your dishes, lick your hands, and you use the hands to eat your food or to rub your food or to touch your artillery utensils and so, and you use them again in eating. So and so and so. Those are just the things. And sometimes they carry lice that could swap over to your body and start causing, sting you and start causing you some infections. Then we have social distancing. I would say social distancing. Yeah, when you normally distance from people, when they sneeze or breath, bad breaths or breaths from certain respiratory infections can be transmitted through that, not necessarily when they sneeze. And also when they have infections like coryza, rhinitis, and so when they sneeze, they can infect you with that. The use of face masks. You may never can tell what is in the flu, in the air, particularly in a polluted environment. So when you move around, you are inhaling every rubbish around. You could get some infected if the air is polluted at that particular period. Then using insect repellents. If you can apply insect repellent, particularly evenings when you are outing or when you are sitting outside, different insects could be biting, not only mosquitoes. But when you use insect repellents, most of them cannot come to land on your skin because they are being repelled by the either odor or scent of the repellent you've used. Then we have taken prescribed medications. Prescribed medications. For example, when you are exposed to mosquitoes, you take prophylaxis, prescribed prophylaxis, and those are just the tests. Then we have On the table, concept of communicable disease. When we say concept, we refer to the entities that forms this idea. So communicable diseases are illnesses that can be spread from one person to another, and they are caused by germs like bacteria, virus, fungi, parasites, or toxins. They are also known as infectious or transmittable diseases. I think this is self-explanatory. We have said it before. The concept of communicable diseases are just diseases or illnesses in general that are being caused or spread by germs like bacteria, viruses, fungi, parasites. Some of them either produce toxins to cause these diseases. Some of them just convey it from one place to another. Some of them reform certain germs to make another thing in another person's body. And they were also all known as infectious and transmittable diseases. Many diseases are communicable, including HIV and AIDS. A major global health issue, HIV is a sexually transmitted infection. Tuberculosis, in abbreviation, TB. Sorry, the HIV also immune deficiency. AIDS is when it's full blown. HIV is human immune virus. HIV is human immune virus. Then AIDS is when it has been acquired and it has causes the system to respond. That is acquired immune deficiency syndrome. It has already run the body and have produced multiple symptoms, and that is acquired disease syndrome, acquired immune deficiency syndrome, meaning that the immunity has been compromised, so it's not deficient. So the signs are now the syndrome because it has produced multiple signs. Then the tuberculosis is TB as abbreviation. The second leading infection killer in the world after COVID-19. Then we also have malaria. And we know TB very well, right? It can infect the lungs, which is the most common tuberculosis. But we also have TB of the skin, we have TB of the bones, and so on. In fact, we even have TB of the blood cells. Then we have malaria, a disease transmitted by the bites of the anaplex mosquito. We refer to the anaplex mosquitoes as the female mosquitoes. We also have viral hepatitis, a disease that can be spread through exposure to infected bodily fluids. Viral hepatitis. In fact, this hepatitis, viral hepatitis, is highly infectious, even more than the HIV. A droplet of it can spread quickly, and just a spread of a droplet can infect another person. It's highly significant to replace. And even when you buried the virus for a year, 2 years, it will still remain alive. For example, is in a contaminated fluid or blood, while you use this a syringe to retain those fluids or the blood, and you bury that syringe, the virus will remain there and it will survive for even 2 years, well buried on ground. So you could see how dangerous it is. Then we have influenza, flu. They are also all product of viruses, a disease that can be spread by coughing, sneezing, and saliva or mucus or unwanted hands, unwashed hands, sorry, unwashed hands. For example, now influenza, mostly the symptoms, influenza sounds more of symptoms, which is flu. The runny nose is just what is common in it, but different virus could be responsible. We have coryza, we have influenza, we have rhinitis, and so on. So, even though some of those symptoms were coming from irritation, but some were actually caused by virus. And the treatment is very real. All antibiotics don't kill them. So most often, no one will just allow to see nose running from his nose. He must respond to it either by bare hand cleaning or use of tissue, which may soak to the hands, and so on and so on. So it could be transmitted through all this medium when it has an handshake with another person, and this person did not wash his hands. The person that cleans the nose with the hands, their hands, did also not wash his hands. They can all transmit this thing to themselves. Then we have neglected tropical diseases. Neglected tropical diseases. A group of diseases that can be prevented or controlled and eliminated when neglected. For example, the ringworms. Ringworm is a skin disease caused by fungi. We all know it is common. And unfortunately, we neglect it in the heads of children. If we raise campaign, we can eliminate ringworm. We can eliminate ringworm. Ringworm has no space where there is neatness. So if we maintain neatness and the hunting for ringworms, particularly in the low income, within the low income areas in the community, in ghettos, where you see children commonly with this, like the almajiris, why they are getting ringworms and why they are transmitting ringworms to themselves. It's because it's contagious, so they could, and they're sharing carbs, sharing clothes, sleeping in the same place, sharing pillows and whatever. Unfortunately, they are not having adequate body care. Mostly days, they won't even bath, nothing, and so on and so on. They will have athlete foods. I think we all know athlete foods. It's a skin disease caused by fungi also. Some call it water chinrua, or what do you call it? Mostly on the foot, chinrua. When you too much salt your foot on the water, or you too much use cover shoes, you didn't allow space, air, and whatever to get there, it often causes it. And sometimes, I don't know, it appears to be something that we can also inherit. Mostly, if your parents have it during time, you can also come up with it. So that is one of the things we can see in the athlete foods. And it can also be careful. That is that for the athlete foods. All it needs is to space the foods, put an antibiotic powders and so. Then it's very, very sensitive to canastin creams and creams of that nature. Then we have West Nile virus, a disease carried by mosquitoes. Uh, this, uh, this is not common here in Nigeria, but in some countries like the Philippines, you see them, they call them dengue, and so on and so on. They have them and the different names, and the different region has the presentation. So actually appears like malaria, but the treatment in some are very, very, very uh, responsive to antibiotics, not like the malaria that we have to get some anti-malaria. They are responsible. They are very, very responsive to antibiotics. Then we have Lyme diseases. a disease carried by deer, ticks, or black leg ticks. We all know what is ticks. In Hausa, we call them koti. They are wonderful animals, or let me say insects. You see them flat, but when they suck blood, they easily form a pouch that will even be like a bag. Sometimes it appears transparent that you can be seeing blood that they have soaked inside the bag. And you could detach that bag while they continue living. That is ticks. And they are so wonderful, they tick to their own parasite, not to their host. They stay there permanently. They suck blood over and over, and they will be growing. They will make a big belly from that blood they are sucking. And they also cause inconveniences in the skin as they are biting. It's itching, and so on. And they could also cause some other diseases from their salivas as they are biting to suck their blood. And they could cause anemia in the individual or animals that they suck. Often, sometimes they suck dogs to death. As they become many, they replicate, they multiply. They multiply by either, I don't know how they multiply, maybe they lay eggs and so within the same environment that they are sucking. But you see, this thing could not be easily hold on a human body because we bath every day and so. But the dogs, they already have bears that they can embed in, and they hide and they will be doing the activities there. Unlike the humans, that our skin is smooth, bath, anything there can be seen, can be washed, can be rubbed off, can be cut off and so. But in the animal skin, they don't have this ability to take away anything, particularly things that sticks. But even they sometimes they scratch with their nails and some will fall out. And those ones will cross and get to other animals also. So that is how they share themselves with those things. Then we have other communicable diseases, which includes measles, salmonella, and the bloodborne illnesses, and the hepatitis A, B, and C. We have discussed and we all know what is hepatitis at this level. Most common forms of spread includes fecal oral. When we say fecal oral, something from the fecal to the oral, which is mouth. And this automatically goes throughout the entire digestive system. Then we also have food. When you come in contact with contaminated food and you feed on it. Sexual intercourse. When you intercourse with someone, either a male or female, that is infected with gonorrhea, syphilis, HIV, and so the person can transmit. The insect bites, as we just say now, the mosquitoes, ticks, and so. They also have contact with contaminated fomites. Of course, when you have contact with a person that sneezes out and you just inhale, and if there's anything there, you inhale it. Then we have droplets or skin contact. That's also part of the droplet, either saliva on the handle of the door or anything like that, and you come in contact with, or on your skin, and it grows. It's okay. Then we have communicable diseases can be spread in many ways. Physical contact by touching an infected person or a contaminated object. Sexual contact, diseases like chlamydia, gonorrhea, and syphilis. Also HIV. Fecal oral contacts, diseases like rotavirus, polio, that comes from the stool through water and so. If there's polio stool, polio infected stool, and the rainfall, you drain it to the river, and then people go and fetch the water from the river and drink. it can also cause polio to those people again. They have respiratory droplets, diseases like influenza and the mumps. Then contact with blood, diseases like HIV, hepatitis B, and hepatitis C mostly occur during blood transfusion and share of needles for injection. Then contact with food, diseases like salmonella, E. coli, and so can be contacted uh, through foods, through contaminated foods. Then contact with water, diseases like cholera can be easily drunk from water that is infected with those germs. The insect or animal bites, diseases like West Nile, rivers, Lyme diseases, and rabies can also be contacted through animal bites like dogs also. Then breathing, and then are also komodo. Those animals are also highly poisonous. They can easily cause diseases to humans. Then breathing in, diseases like tuberculosis and the measles can be shared through respiratory. If you stay too much cloistered and unventilated area, you can infect each other with all these things. Then we also have the severity of a communicable diseases. Infection can range from asymptomatic to severe and fatal. Just as we say, some doesn't have clear symptoms and while they are eating. Some have it, but they must observe incubation period before the symptoms start surfacing. And even with that, some could be fatal and some could be chronic. So I think we should hold this class here. Next time we continue from the general principles of control of communicable diseases. So we have to continue here in the next class. So thank you very much for watching and paying attention. Thank you very much. I wish our next class should be contact, not only video lecture. Thank you very much. Bye for now. Bye for today. Thank you very much.